got a Prednisone warrior question. It says, and this is about the thyroid and prednisone. Elle and I put me on a short term of prednisone when I was 45 years old. I was having normal periods up until the day I took the first pill. Nothing since. After 3 days on the pills, my hair started falling out, skin flaking off, felt like a drunk sailor on a ship in a hurricane. And I gained 45 pounds in 2 months, which at 67, I'm still packing most of it, regardless of my diet. And yes, constipation has been a problem since the first dose. My hair is still breaking off and falling out, and skin is horrible. My teeth all rotted out within a year. Doctor told me never to take it again. Allergic reaction? Can prednisone cause permanent damage to my thyroid, as they have found cysts on my thyroid? Can some of the problems I'm having still be caused from that? So you took prednisone over 20 years ago and you're still suffering. And you're wondering, is that from prednisone? And I have to make a disclaimer here. This isn't medical advice. I'm not your doctor. Talk to your own personal doctor for your clear medical information, because all I have is the information you shared with me here. So after that disclaimer, I want to say that yes, prednisone can cause permanent damage to your bones, to your thyroid, to all sorts of things. It's basically stealing these nutrients, all of these important things from our bodies, and so to keep us alive. And it's doing a miracle of keeping us alive, but it can cause serious damage. It's pretty rare to have thyroid issues, but it is possible. And what's really hard about it is there's not a lot of research on prednisone side effects. There was no drug company that had to do research on the side effects. And so what we have is just random scientific articles throughout the decades. Prednisone was FDA approved in the 1950s. So here's an article from the 1950s. And this is most of what we have. It's really sad. It says activation of the adrenal cortex by corticotropin and the administration of adrenal steroid hormones, that's prednisone, profoundly influences thyroid activity, the level of circulating thyroid hormone, and the renal clearance of iodine by the kidney. And so, this paper is talking about how prednisone is influencing the thyroid activity in man. And then I found one more article from the 1970s, and it's saying another side effect of cortisone is suppression of thyroid hormone secretion. That's it. Like, I can't find much more than that. And what's crazy is they also use prednisone to treat thyroid conditions like subacute thyroiditis or hyperthyroidism. So prednisone is amazing in that it can be used to treat a condition and also cause that same symptom as a side effect. It's amazing. So the short answer here is I have no idea. Nobody's actually done that kind of research to know for sure if these could be from having taken prednisone. But the timing makes sense. Your normal periods, and then 3 days later, your hair is falling out, you're lost your period, you're miserable, gained weight. That all adds up. It all makes sense to me, but can I back this up with more than that amount of scientific evidence? No, I can't. They just haven't done it, and it's relatively rare. And so, yes and no is the answer. I honestly have no idea. But yes, all of your symptoms do sound like thyroid issues, and so be sure to continue to get your thyroid's hormone levels tested, and sometimes they're not checking the right ones. It's really tricky. So if you're not getting the answers you need, find a different doctor, because thyroid treatment is almost as much an art as it is a science. And so maybe there's another doctor who's got that art down better. Hope this helps. Signing off as Dr. Megan, your prednisone pharmacist.